Okay, good morning, everyone. Thank you for being here today. As we can start the meeting, we're attending the City of Laredo Blue Ribbon Committee meeting for January 20th, 2021. And so I'd like to start the meeting by reviewing and approving the minutes for the last meeting that we held on December 16th, 2020. So if you all can take a look at those, and if there are any revisions or changes that have to be made, please voice your concern or the changes that we need to make. Any changes or revisions that anyone can note? If not, then can I request approval of the minutes?
I move to approve the minutes.
Can someone motion, and I need a second?
I second to approve the minutes.
So who motioned?
Jackie. Oh,
I did, Jaime.
You seconded.
I moved the motion, Jaime.
How's that?
I did, Jaime.
Okay, Jaime, thank you so much. Okay, good. We can move forward then. We have a motion and a second to approve the minutes. Thank you so much. Any
As previously mentioned, Mr. Chair, we have provided the WebEx link and password for those interested in doing public comment to join us in a meeting. At the moment, we do not have any additional individuals in our meeting for public comment.
Thank you. The next item we have on the agenda is a guest speaker by the name of Emma Faye Rudkin. She's the founder and executive director of the Aid the Silent. Okay, and so I'd like to say a number of things about Ms. Rudkin. She is, and I'm reading off another computer, so excuse me if I don't look at the screen. Emma Faye went profoundly deaf at the age of 3 and has spent her life turning a disability into an ability. She is an internationally known role model and public speaker for the deaf and the hard of hearing, as well as founder and executive director of Aid the Silent. Travels the country with her service dog, Hank, sharing her story. Emma Faye is both fluent in sign language and spoken language, and thus being a bridge between the deaf and the hearing. Emma Faye and Hank are set to debut this December on the children's show Hank and Emma Faye for KLRN PBS channel, focusing on inclusion. Emma Faye was crowned Miss San Antonio in 2015, as well as in 2017. In 2018, second term by Governor Greg Abbott to serve on the Texas Governor's Committee on People with Disabilities. Morgan's Wonderland placed Emma Faye on their Wall of Fame as an to do great things for individuals with special needs. and she was recently chosen as Atricon People's Choice Advocacy winner for 2020. So I'd like to thank you so much for being here.
That is so sweet. Thank you so much for having me. And I want to thank y'all for doing the hard work of advocating and supporting those who many so much in my life to feel like I have what I needed for success. And that's why I do what I do different, because I have people like you that come alongside me and really just change so much of how I was able to look at life and my education, employment, so many things on this call.
Somebody with no sign language. No.
So I'll use it just naturally, but I won't worry about signing and talking. It's really hard to do both. So it's like
Okay,
doing different
that's fine.
languages and rubbing your belly at the same time. So it's two different languages. ASL is not actually English texture, and many people don't know that they would assume it's gonna be typical English word structures, but it's not. ASL is actually concept for concept, and so that's why you help deaf children early on to associate the English word with the sign and the concept. That's why you see such a severe unemployment rate, underemployment of the deaf will not graduate from high school, and only 5% will graduate from college. A lot of what I do for a living as well. So early on, I was actually not born deaf. They believe I became deaf around the time I was 3. Now, this is before they had early newborn screening. So I could have been born deaf. They don't know because at that point it wasn't required by law that you had to do screening for newborns. But they believe it's in correlation to when they think I was sick around 3 with a very high fever. And immediately you're put into a system. This is before really the internet, and so there was no support group to find other deaf parents, having no clue what to do. I'm actually Bonnie, Texas, so a little smaller of an area outside of San Antonio. There was no deaf community. So she was very alone. So all of a sudden she's told that her daughter is deaf. And so they kind of got used to that normal. And one of the things my mother says that it's so important to have good customer service because the people you're working with are very oftentimes frustrated. And so they're just desperate at the point that they get to us. Even I do a nonprofit side of it. I do a lot with Governor Abbott's Committee on Disabilities. But by the time you get them, a lot of times they do not have happy news to tell you. They have very difficult, very frustrated. So it's really our job that we make them feel like they're heard and that we help them get to the next step of what needs to happen. But my mother describes that moment of she was deaf with her own child. And it was a very overwhelming moment. And the thing that she remembers the most is just the lack of sensitivity. Told her she said it was like they were telling her how to make a sandwich. It's very detached, very unemotional. So we got used to that normal and put into hearing aids. And still, insurance really does not cover hearing aids. And Medicaid, a lot of practices won't accept it. And so my parents had to finance every single pair of hearing aids. And from the time that you are diagnosed, so for me that's 3, to high school, and each device costs anywhere from $5,000 to $10,000, with all those additional costs. So insurance doesn't cover it at the most, and then Medicaid, most practices won't take it because it actually costs the audiologist more out of pocket to pay. So those are some of the issues my family would be facing. And early on, I was pretty clueless that I was deaf. Like, I really didn't understand what it meant. But as you get older, you start to realize those differences and the way that you stand out and the way that I watch my friends. They would have and then they come back and do fine on the test. Well, what was happening for me, because I was from a small town, I actually went deaf education. When you have a deaf teacher with you who's helping facilitate the content, I was very much on my own. I had hearing aids. I sat in the front row. I used a device called an FM, so it's a little mic. Much my advocacy went for a young child. My mother was incredible. She would meet with every single teacher and explain how I would hear. And she would play tapes of my hearing loss, what it would sound like. She would give them a list and list of things to do to face. The exams aren't given through spoken instructions, but they would be written instructions. Just list and list for the teachers, and she would always bring me with her. And I would be this little girl, just so bored. Why are we meeting with the teacher before school even starts? And my mom would always say, you're doing this because one day you're going to do it for yourself. You're going to become your own advocate. And little did I know, not only would I become my own advocate, my dad. So I was totally being set up for my future and I didn't even know. But I did see a difference where I would have to go to school all day, be so exhausted from trying to lip read, understand, trying to listen. And then I would realize I was missing so much of the content in school that I myself school. So for my friends, it would take 30 minutes to do homework. For me, it would take about 3 to 4 hours every night. I would just sit there and try to reteach myself school because I would completely miss concepts. And then you go to very early on realizing that injustice of not having equal access to my education had nothing on me. That you believe as a young child something's wrong with you intellectually, that I wasn't smart enough. And so I really had to combat that, I'm I need to understand. So, so many times I had a teacher once, when I was a freshman in high school, 10 years to speak English. So I was not very hopeful in my Spanish class, but I'm in Spanish class and she kept playing audio tapes of a language that wasn't a language I could even understand the vowels. I told her I would just fail these exams because she would play audio tapes of the Spanish and you have to write the answer in Spanish what you heard. And I would beg her, I was like, teacher, you don't understand. I first of Spanish, and I said, secondly, you're playing it from an audio tape. That's so distorted, that's not clear. And then you're following me on didn't want to be treated any different. And that was the moment of, you know what, I don't need to be treated different, but I do need you to make accommodations. And there's nothing wrong with trying to meet me where I can actually be at the same playing field as everyone else. So a lot of this job is, you know, helping other people just be on the same playing field. So that is such an investment in their future. And so things started happening where I realized it was so important to have that equal access and those accommodations. And my childhood was constantly looking to belong. And I interact with friends on the playground. This is a sadder story, but things would happen. For example, I would go to school and hear that so many people were going to go dancing or they were going to go have a party somewhere, like a birthday party. But then they would talk about it, and come Monday, you know, and my feelings would be so hurt all weekend thinking, why was I not invited? Why was I not you there? Like, we invited you, we told you. But because it was something that was said, I didn't know. So that was a lot of the painful things in my childhood. And then when I was 14 years old, a really dramatic life shift happened. I went from hating my hearing loss, hating the way that I speak because I've never known what normal speech sounds like. So speech therapy, how it worked for me was just hours every single week, sitting with a therapist in front of a mirror and mimicking what she was doing. And then a lot of times, I would put my hand on her throat or in front of her mouth and feel the but my speech will always stay this way because I've only had hearing aids, and hearing aids, it's a computer generated sound. So my hearing loss is frequency loss. So people always make the misconception that, hey, I'll just over enunciate or I'll talk really, really loud or because that's not the natural way of speaking. So I still can't figure out what you're saying. So if you just speak at a normal pace and normal volume and you're facing someone, clearly where their face is well lit, you can see the spoken language deaf. So I'm an oralist first, but I use speech and hearing aids. And then other deaf will be a signing native, like that their first language is sign language. So my I started to I'm now fluent because I kind of became a part of the deaf community in college. World and the deaf world. But so just to explain hearing loss, frequency loss, people have different frequency on the level of hearing loss like me, and they hand me the listening devices, like the little headsets at the movie theaters and exist. So if you think on the alphabet, and trends of frequencies, how that sounds is if it's a high frequency or low frequency. Most of the alphabet is actually high frequency. A, C, S, G, all high frequencies. So what happened to my hearing loss, that means I can't hear most of the sounds and speech. So I live you said that I read this. I believe I heard that this is the context of what's happening. Of what we're talking about. Being able to see your face, being able to see your hands. If you meet someone out there that you can be able to interact, even if you learned basic sign language, just the alphabet, you can communicate pretty well. Even with the basic alphabet, you're able to ask them, hey, how do you sign that? And you can start to interact just with basic sign language, because the deaf community is desperate for communication and for human connection. So even if you learned a most basic level of sign language, you would change. Once I was 14, I was pretty desperate for a change. I started to really think, what's my purpose in life, and how can this be a good thing, being deaf? Like, what is the purpose of my life at this point if all I'm ever gonna know is the struggle of being deaf and having hearing loss? And so I went that week, and it was such a shift in my story, because I learned for the first time that hearing loss was going to be used to help people, and that the most broken parts of my story I am living this story because one day I'm going to help other people in their story. And that was an incredible moment of looking back and knowing that I had so much more from my life than I'd ever tapped into. And that's something that is so important to at the end of the story. You can have great joy, you can have great purpose. And so that was a pivotal moment where I started growing in this incredible confidence. I went from someone who could hardly speak in front of other people, who could hardly interact, who could hardly stand up for myself, to all of a sudden being this really confident person who was not afraid of anything. So literally, I can sum up the next couple of years was, if someone told me I couldn't do it, then guess what? I was going to prove them wrong. And that's music. Like, well, I'm going to sign myself up for piano lessons then. And I learned to play music. People saying you can't make the show if you sing. Where I started singing, and I learned to play the vibrations, hours of practice. How I learned to sing and play music was I sat in the corner of my bathroom, and I would sing into the. I was able to learn that way. Started doing cheerleading, started competing, started playing music in coffee shops. So the next 4 years, I really grew. And so when I got to college, I went to UTSA, to University of Texas, San Antonio, and randomly that I was signed up to go to a meeting about Miss America, that it had all my name, all my information, and I was walking through campus, and at this point I was a hippie child, no makeup, had nothing to do with that at all. And I'm still shy, although I was growing confidence. And that email said, like, be here at this time, like, you're signed up and you're already in the program. So I started asking people close to me, hey, did someone sign me up for Miss America? Because I'm horrified and I don't want to go, and I don't know how these people got had actually signed me up for this competition. So I'm like, how could you do that? That's, that's so embarrassing. Why would I ever do that? And my mom reminded me that one of my biggest dreams was to become growing up was actually named Heather Whitestone, and she was the only Miss America who was deaf, and who she was 1995. So that was one of my biggest dreams, was to play music and compete in Miss America. So closely that you're settling for your second dream, not the big one. And so I ended up going, and I knew in my heart that I was going to win it. That competition, it was Miss San Antonio in my heart to start an organization. So I had many times in my mind, I knew that that was part of my calling from the time I was 14, that summer that changed my life, that I was supposed to start an organization to help deaf children and teenagers. Entire website for Aid the Silent, the organization, was able to apply for the 501. All of that, and Aid the Silent is now 6 years old, and it's been amazing. We've serviced hundreds of children and teenagers, and I can explain a little bit about the nonprofit and how it works. Because go to the pediatrician to be cleared to go to the ear, nose, and throat doctor. Then you have to be cleared medically by the ENT to go to the audiologist. And then you have to do the molds, the impressions, more tests. Then you have to come back for the fighting entrance. You're trying to come up with the funds to do it. You have a young child, maybe you're a single mother, maybe you have multiple dependents, maybe you have other children that have needs, other different needs. And so these families get frustrated. Medicaid coverage and all sorts of help. They're trying to get so many resources. So we saw by the time that you fought insurance and by the time you made it through the system, a lot of these were missing critical windows of early intervention. They were missing critical years of education. And a lot of times, if the school district has money, has the funds, they issue out school loans. They go home and they can't take the hearing aids with them. And on the weekends, they can't take the hearing aids with them. So think about all the extracurricular activities, right now trying to do school online, not being able to hear your face. So these kids, even if they're in a wealthier school district on paper, a lot of times they're all best done for the regional school for the deaf, that day school for the deaf. So they're from all over the city. So even if it's a wealthier district, a lot of times. And so Aid the Silent was designed that we were done waiting on our system. That was taking forever. And it's funny because I actually do so much on a state level to help with those systems, but the nonprofit was designed that children can come at any moment and we will quickly get them the resource and not have to go through all the red tape And even though we are able to quickly to provide it, we also came up with an even better idea of we have what's called a hearing aid pop-up clinic. So we bring in all those 4 different doctors, sometimes 4 to 5 different doctors on one location. The children get scheduled appointment time weekends to get hearing aids. So we've been able to service in this new way. So we've serviced a couple of hundred children, but in this new way, we were able to service the most in the shortest amount of time, which helps us in follow-up care and all of that. So that's the biggest part is really the resources. We spent over $250,000 just on resources this past year. It's negotiating with audiologists and ENTs. So that's been pretty amazing. And then the other part of what we do at Aid the Silent is we have education. We really do not have a budget to help deaf education. They're really missing, just in general, they're surviving. They don't have the resources. So we will go in and help the deaf education kind of fill their classroom. If they have needs for, if they have inventive ideas or we will actually go and help them get the supplies to be able to come up with the best way to teach deaf kids because there's not a lot out there for how. So a lot of times teachers will come up with their own type of curriculum to reach deaf kids. So we go in and we'll help create. We partner with the ballet, and we have this amazing technology that vibrates with the music. So it's this little backpack that the kids wear, and it is synced into the sound. So they were able to watch the ballet. To recreate things like that, we've been able to pay for all these kids to go on a field trip to have like a deaf teen support day, and they got to go to. So we help a lot in that way for education. We also have a portion that's super important to me is our deaf ministry portion. So we actually send kids all summer. We have different opportunities for them to go to an amazing camp in Colorado. It's called a Young Life Camp. And they get to meet so many amazing other kids and have experiences. And then also we have a the ministry portion. And then awareness is important. We have all sorts of deaf accessible events where we will provide the whole range of accommodations. Have an amazing interpreter there, like at our 5K. We did have a music festival for the deaf, so you could feel the music and experience it through light shows. We bring in the sub pack right next to each other. So when we have events, you could be anywhere in the event. You don't have to stay to like the deaf section. You can actually go in the event and see interpreting and captioning from wherever you're at. So Aid the Silent has met so many needs that we're missing. And so that's probably the main part of my job. And then us being a member on the government testimonies, it's hearing issues, addressing that. So very similar. But do we have time for questions? I don't know if we do because I talk a lot. That would be Diana. Yeah, I don't know if we have time for questions. Can I talk a ton? Okay, I think we're done, right? Diana?
I want to thank you all your achievements and all your successes and all your challenges.
Well, thank you.
Okay, I know it's you've accomplished, lady, and so I congratulate you for that.
Thank you.
And I think we need to thank your mother also
Yes.
for for being a mother and refusing to just accept whatever fell on her lap, and she pushed and promoted you. So thanks to your mother, I think a lot of individuals are now benefiting from advocacy skills and abilities in organizations. And so we thank you for what you do for all the deaf community.
Well, thank you for that. So kind. I think, yeah, Rebecca emailed me. That you kept nodding. When everything I said, you were like, yes, yes, exactly. So, thank you. I'll write my email in to you. Any more questions? We don't have time for questions.
Any questions from our school district people?
No worries if you don't.
Yeah. Emma, this is Diana, and I just really want to thank you. I know we've been trying to communicate, and it's finally happened, which is a great thing. I know these pop-up tents, I follow what you all do. I've been in communication with your office to understand what all that is. And I understand they're working on, or you're working on a border initiative, and we would like to see how we may partner. I know there's a lot of logistics that go into that, and right now with the coronavirus and everything else, but we would assure to secure, of course, meals and a venue and assure that everybody's got their PPE and all this good stuff in partnership with the folks in our community. So we offer that to you and want to jump on board for your border initiative. We are Texas Workforce. Ms. Jeanette here, Ms. Jeanette Ramos, who's the secretary here for the Blue Ribbon, is also our manager that covers both two workforce boards. It's the South Texas, which is Laredo, Zapata, and Hebbronville, but we also cover Middle Rio Grande, which is Del Rio, Eagle Pass, and Uvalde. So we've got two border areas, of course, being Laredo and Del Rio. If that initiative was possible, if there's any way we could jump in, we do have a lot of resources. I get you, all the red tape you don't want to deal with. There's a little bit of red tape, but hearing aids are usually not that difficult for us. And Ms. Jeanette, maybe you want to chime in and just share a little bit about that endeavor with possibilities of working with Aid the Silent.
Mm-hmm. Yes, thank you, Mrs. Sanchez. That was one of the questions that I had, is how involved are you with VR? And yes, I do understand that it is a process. Anytime you're involved with a state agency, it's always a process. But I just wondered if, in hearing you talk, I feel like maybe we could get together and do some kind of a vocational initiative for these individuals. Since we're about employment and preparation for employment, and there may be a way for us to refer individuals to you, to your initiative, or for you to refer them to us for services. We do provide hearing aids. Weeks, but it's pretty quickly. And so we would like to fill in whatever gaps we could in working with you.
Oh yes, I take any help. It's constant. So that's just, I think a lot of it is probably just people not fully knowing what's out there. So sometimes it's like we tell them, hey, this is the service and this is Texas Workforce, like here's a contact, go here. So I work a lot with our deaf support specialists here as our two representatives. But I think a lot of it, I'm always shocked. We always could information, full of information. I'm always shocked that a lot of them have no clue about the tuition waivers. They have no idea.
We do that.
And so a lot of it is just education of here's what's out there, like don't waste this. And then even more so, once I teach them, it's like, well, I'm supposed to watch all the other siblings. My mom and dad are at work. Like, how can I go to school? And so that
Yes, we have seen. Yeah, we have had customers, or I remember at least one that came to us really for career assistance, and she had deafness and was so upset when we shared with her about tuition waiver. She was like, I can't believe I have been through so many agencies. I've gone to so many doctors and nobody ever told me about that. It's just incredible. I mean, you can't even believe it. She got a degree, with whatever financial aid, loans, whatever. No one ever shared that with her. So, yeah, it is very unfortunate.
Everyone, this is Georgianne, Dr. Georgianne. I would like to request something if it's possible. This committee maintains a web page within the webpage of the city of Laredo, and we have a section for resources. And in listening to you, you've just given us all kinds of possibilities for our population who is hard of hearing or has some degree of deafness. And I would really love it if we could get it through you to maybe Erica or Diana, to where we could add the resources, the web links for our population, just to give information of all that's out there. I would really appreciate it so we can add it to our resource page.
Yeah, I put my email in the chat box. And then also Diana has my information as well. If you want to connect later. But yes, and another thought, this may not be related, but another thought is how much doctors do not share what's out there with VR. And so that's another thing that might be a good tackle. It's just that they would even know. Because I listened to a video of but sometimes it's another number, another patient, and how through a process she felt like she became a person. And there's so many things she had never heard that the state provides. So there's some type of disconnect where the actual professionals that work with the children or the family or individual who is deaf, there's not a lot of relay of information, because it is true. I think they get to the next patient and they're assuming that someone else in their life, some other professional is sharing that, but a lot of times that's not what's happening. So I will have students who are 17 years old and I'm like, hey, what are you going to do for school? Like, hey, go to Texas public school, because nobody ever explained that that's the case. So just something to think about. How do you relay the information to the child and the families? But then it's, once again, they have to be the ones to do the work to get them the resources. They just don't want to. Like, that's always so shocking to me. I'm like, what? You don't want? You hear me? You don't want education that's covered? But it does happen. It's sad.
Yeah, sometimes what we deal with, Emma, is that especially high school students, they don't want to be about services, because then other kids are, and who are they? Why are they coming to see you? What are they doing? And they don't always want that. It's not that they don't want the service, they just don't want to be different.
Yeah.
At that age, you can understand because there's so much pressure. If everyone else isn't wearing hearing aids, then that makes you different. And it's a challenge at that age to get them to receive the services that we offer. So it's tough.
Yeah. Yeah, that's why I do a lot of times before COVID was all I did was go to and just speak about embracing it and embracing hearing loss and being proud to wear a hearing aid and why it's, just those type of messages are important. But yeah, I think the more that they're around it and a positive that would have hearing aids, or maybe they don't identify with deaf signing deaf being those who sign. So yeah, sometimes just finding maybe like a positive role model in the community who is deaf and older. Because for some reason, if it's from someone who is deaf themselves, or maybe someone that had an experience of
Right.
that.
What I'd like to do, if it's okay with you all, if you all would have your cameras on, I'm going to take a picture and possibly we can send it to Laredo Morning Times to announce, of our meeting today and Emma, our guest speaker, if that's okay.
Yeah.
Okay. Nobody can see it, right? I'm good. Is everybody looking sharp?
That's great. And I fixed my hair. Everybody's fixing hair.
Okay, let's see if this works. 1, 2, 3. And I'm going to take one more just to be sure. Anyway, I can crop it. Let me make this straight if I could. Here. 1 second. Okay, 1, 2, 3. Thank you so much.
Can I take one too?
Sure.
Yeah, you can see it. Ready? 1, 2, 3. Awesome. Thank you, guys.
Thank you.
Have a great day. Thanks for
Thank you so much.
Thank y'all.
Thank you. Well, Diana, thank you for connecting us with Ms. Faye.
Oh, absolutely. Absolutely. Anything we can do for our community, that's what we're here to do.
Wonderful.
She's done quite well and she's quite informative and has a lot of important information. So I think she was a very a good guest. So thank you so much, Diana, for pursuing it and finally achieving and getting an appointment so that she could share her story with us.
Yeah, she's an amazing individual. I mean, there's no excuse, right?
Yeah. So don't complain.
That's right.
If I can just interject briefly, thank you so much, Ms. Sanchez, for connecting. I agree. Ms. Faye, this is a committee that is from the City of Laredo Health Department. The department is the liaison to this committee. And of course, our purpose is to facilitate these resources for people with disabilities and just do education. And this committee advises the mayor on, pressing issues for the community, what resources are lacking within our city. So hearing about this opportunity and knowing that you have identified the border for your services, I will we want this to be available to our community. So count us as a partner. to facilitate, entry here in our community so we can provide these resources. Thank you so much. And your story is amazing. And it's great to see. I think having that visibility, you talked about a role model. I think I had the pleasure of meeting she actually helped with our lab, and she really opened, our staff's eyes to the opportunity to work hand in hand with, without any obstacle. They would communicate by basic sign language. So I think for her, I think of her seeing someone like you, seeing, the achievements and the moment to us, but definitely to our younger demographic that might be, experiencing some of the same issues you did growing up.
Mhm.
I think we lost her.
I think we lost her, yeah.
But yeah, I mean, if the committee would, you have our commitment to proceed to make this happen in Laredo.
Yeah, thank you, Erica. I mean, it's a team effort, we're gonna need to bring in all the resources, but definitely we can put it together. That's not a problem. I'm so glad. Much needed. So the age group they serve is from 0 to 22 as well as their students. And we serve 14 and older. So, there's a gap there of who we don't serve, but possibly there would be other entities. And if we need to get the ENTs involved and whatever we're needing to do, I mean, she does have a team, but being that she's got this border initiative, we need to understand what it is, how do we fit in? Because we got big money to serve those people as well. And it's all about, empowering and supporting the individuals. We do have a large deaf community because I recall they would do monthly meetings at the workforce center back in the day, and they were very well attended. And I'm talking all age groups. So I know, Rebecca, you probably be better versed than I am there, but we have a large deaf community, and we need to suit up and see how we can, bring those resources together and help support and make our community a better place, bring people that hope that they're needing. But yeah, thank you.
I already did send her an email so that we can keep communication regarding how she can help us as far as the school district.
I can't hear you, Rebecca.
Hello, can you hear me now?
Yeah, there, I hear you.
It's better.
We can hear you better.
I already sent her an email so that we can communicate as far as the school district, and if you're able to organize like a pop-up event, because I know I can't pull that off by myself. There's a funding, but if you all have the funds to set up something like that, definitely, we help like our children as well.
Yes, absolutely. So I know they've done one in the Valley. And what I'm saying to everyone, I think I sent a couple of emails to some of the people on the committee is, we don't want to be on the sidelines anymore. We want to be on the playing field. Everybody's always eating or we got to be on the playing field. I don't want to be on the sidelines. I'm going to share a story with you real quick. So I worked for General Motors about 10 years. That's where I got a lot of my training. And I was on a committee that was advocating to bring jet service to Laredo. And this is back in the early 90s. We didn't have jet service. You remember the prop jobs? Anyway, so I was on that committee, and I'll never forget the lady's name, Nora Ray. And tugging. But last minute, guess who gets air service, the jet service first? McAllen. I'm like, what? What happened? I mean, this has been going on a long time. So I think it's time. I think we're great. We've got great resources here. I think we all have commitment, skin in the game, that we can actually make something happen. Of course, with Jeanette's leadership, Mr. Castillon here on the BRC, Dr. Ruthinger, Jackie. I mean, everybody's important to put this together. But I'm going to challenge them to assure that they include us on that border initiative. It was, there's commitment, there's passion, there's heart there to assure that we put Laredo on the map and that our people in our community are taken care of, and that's what we're going to do. So thank you. I'm not going to talk anymore. I'm done.
I wanted displaced because we had mold in our office. So that was kind of where I was working out of temporarily. And I remember this couple, I'll never forget. They came in, this guy was a middle-aged, and he was this big, tough guy, tattoos and a leather jacket and about to make him mad. And the wife or girl, because he couldn't hear. And so they come in, they sit down, and we do the application. It's kind of like a little headset that just amplifies. Kind of like Emma said, it's not a him instead of just the girlfriend. So we're there and taking the information and all. And all of a sudden, he put his head down, and I thought, oh God, I bored him to sleep. And she's like, what's the matter? They're asking you a question. Are you okay? You're feeling sick? And he put his head up and he had tears in his eyes. And he said, there was a clock way across the boardroom on the wall. And he said, I have never heard a clock. And I just it makes me emotional even now. What we take for granted in our everyday life and doing what we do and rushing here, rushing there. I thought, wow. And so, yeah, we do have to reach out to these individuals because chances are they come in when it's like a complete problem. They're about to get divorced. They're having marital issues. The wife's tired of the TV blasting. I mean, they're just kind of like, we become like the last house on to them earlier when they're younger and they haven't lost and suffered so much. So I just wanted to share that because it just reminded me as I was hearing Emma speak.
From different disciplines, and at one point or another, there's always a client. Just never forget them. And I remember certain individuals in certain situations in my past as well. I just never forget. I can tell you that for years I took it for granted. When people were having a mental health crisis, we hospitalized them. I had done it for so many years that I had just become immune to it. And it wasn't until one time when I was in the hallway and they were escorting a young, she wasn't an adolescent, but she was a very young adult. She was crying. She was being accompanied by a police officer. She was handcuffed. She was crying because she had never been there. She had never been hospitalized, and her impression of what a mental health hospital was what you see on TV. And she was crying in the sense of, you could tell that her fear was like deep rooted. It was like really like profound. And I was like, damn it, this is what it really feels like. And I had never, it was like an everyday thing. I had never actually seen what somebody goes through. And you gave me a real good idea about her mindset was and what her thoughts were. And they were horrible. And I was like, you've been doing this for so many years and you've never really seriously considered. I learned a few things that day and I've never forgotten it. And so now I think that all of us have experiences like that you just never forget. And you realize that we take a lot of stuff for, and it's not until they take it away that you realize that I've been not as grateful as we should be. We've been, okay. We should be grateful. What we do have, and we have all our faculties, and like this Redkin. I was chatting, I was sending her chats, but I was amazed that she was able to decipher our speech when we spoke back to her. I don't know how she was doing it. I was curious to ask her, but I don't know if she was responding. Knowledge and some degree of ignorance as to how people overcome their abilities. So thank you, and thank you, Liana. And yeah, we can put her website or her organization on our website. That would be really. Any other question? Any other issues? We can move on to item 5, I guess. Cristina Reyes, thanks for being here. Thanks, Chris. You were with us as well.
Yes, I have quite a few things to share, and I'm going to try to go through them as quickly as I can. But
Okay.
if you have any questions, please stop me. And if any meeting, it went at recess by 11 p.m. So they'll continue they'll continue the agenda today at 5:30. I believe they're going to go over the consent agenda for the health department, which provides in submission R18 that our program is going to be ratifying the submission of the continuation grant application $127,000 and 561 with no match to continue the City of Laredo Health Department Family Support Community Resource Program to assist families with children and with special health care needs for the term period of September 1st, 2021 and August. An extension of this program by the state from our last regional meeting, which was in December. With our grantor, we were awarded for an additional year because of our service individuals we served that yielded us 80% above the awarded service rate. In other words, each individual we had, we were rated above 80%, which was a really good outcome for us, as well as we got recognized by the state towards hence being rewarded an additional year for this program. Of course, we hope to continue what I and Ms. Garcia did was we did go above and beyond because we knew the barriers were going to be location, transportation, we did go above and beyond and go after hours because we know there was families that were working, as well as communicating them through Zoom and making sure that we would assist them with any questions. So the state found that to be very, very helpful, and that was a lot on the survey was common and going above and beyond. So I'm really happy to announce that we were awarded an additional year. Currently, our program last week, we were able to issue 250 gift cards to provide families with $100 towards HEB. Grantor explained to us that this emergency project that was presented was done on our behalf here in Laredo, and other cities took onto it, and it was very helpful during the lockdowns, as well as families that might be going through total of $25,000 that was emergency monies from the state that we got to transition into gift cards for families, and we in total 250 families were helped from our program. We currently are in phase 3 of our schedule and outline for our health director's approval for the visits and connect the and healthy living programs. Once we get that schedule in and we collaborate, we're going to give it to our health director, see if everything is approved, and we'll start with hands-on with the hands-on of the project, which is starting to build the garden beds, as well as starting to do at home. In the month of December, I did connect with 4 community support groups for a workshop for caregivers and parents on tips to manage emotional health during the holidays. We connected with the families of autism Miles from Heaven, the Golden Heart Project, and we also shared this information through our social media platform for the community. The educational workshop is required by the state grantor. So when we worked the workshop, when we provided the workshop, we did it in efforts to assist the caregivers during this round. We knew during, again, under these resources we were going to provide, because again, we've been having a lot of feedback that to give a just very being enclosed at home, having to deal with having to go to school and not go to school, virtual learning, and parents having a different role, also being teachers at home. It was just becoming over. Decided to do the workshop. We had a successful first run with 24 caregivers that attended the workshop. We provided a burnout assessment where a lot figuring out what they need to implement in their life so that they could help effectively be healthy, both emotionally, mentally, and physically. And during the workshop, we provided all a success story on that project. We did get a caregiver that came in to get services from our healthy living program. She thought she was healthy. She thought she was doing fine. She did her pre-lab work with the healthy living, where she can help manage her diabetes so that no secondary issues occur. So this was great knowing that, it wasn't great as far as her results, but it was good that we got her through the first step of being able to look at her health and then also being able to tend to it. So this was a great caregivers about, what more we can add to it, and if possible, get additional specialists to come in so that they can get more information. We're currently as our program inclusion. We are collaborating with several districts, or I believe right now one district that will be able to share. We're going to be able to share data from our surveys and local feedback on these specific projects that are needed. And ADA transition plan for the Parks and Recreation Department to help with these projects. Of course, we're in the planning stages, and it's currently working to see where funding is going to be available. But I will continue. I've coordinated also with doctors and Doctors Hospital to present a new initiative that was given to me by the University of Texas Disability Study Center. Implementing a one-page profile. It was a webinar that was done by Ms. Shelby Davenport, where it's going to be focusing on the disability community that enters a hospital for care. Since COVID is still very, very big in our city, and hospitals admitted, they might not have a individual, a caregiver, a parent, or family member that could go in with them due to the guidelines that the hospitals are now putting. So Ms. Shelby Davenport worked a new initiative in Austin, Texas hospitals where a one-page description or profile is provided for the individual. It's almost like an emergency preparedness plan, where it gives more information on the individual that is being cared for to help alleviate services. So this one-page profile, I'm going to be doing a workshop for the doctors, hospital nurses, and staff for patient relationships. And they're going to also be providing it by their whiteboard, where the nurses keep notes as far as how many visits they take. And again, this one-page description or profile will have information on an individual that has a disability. And I can give you an example. If the individual has an intellectual disability, they'll put the caregiver or they themselves can put information and say, I love crossword puzzles. I love to color. I love flowers. I love talking to my mom every day. So that when nurses and doctors go in, they know how they can relate to this individual to make it a more calm setting, and also help them feel comfortable while their loved one is not there with them due to the times that So the hospitals thought this was a great initiative to implement for our disability community. I'm still trying to get in contact with Miss Bettis from Laredo Medical Center. I know with her schedule, she's she's actually one of the I'm very respectful of her schedule, so I'm hoping soon LMC will jump on this initiative as well. I thought of first reaching out to the hospitals prior to educating the community on it, because I didn't want to educate the community first and then show up with the information and the hospital say, well, we don't understand what you're giving us. So we've already provided for the community. Again, a lot of these initiatives that we're doing, I understand our program focuses on children and young adults, but this would work for all age groups, population. New initiative too for the community. let me see. We're currently creating videos this week. These videos are going to focus on COVID-19, caring for a child and youth with special healthcare needs, and also 10 COVID-19 preparations to do right now for medically complex families. I think this information should, go out by there's probably a lot of families that need a little bit more information, preparation information, health tips if they're caring for an individual that has a medically complex condition. Of course, we're going to be mentioning CDC guidelines and recommendations and the state issue information that was sent to us by our grantor. January, we did focus on birth defects awareness and glaucoma. During these health conditions. Of course, birth defects, it could be in the womb to birth and so on. So we do mention to the community in the educational video that if they were to get with their doctor and find out early on, they can start preparing for the resources our program offers from the state to assist their child that's going to have a birth defect. And as far as glaucoma awareness, I do glaucoma. So the education on that was we teamed up and collaborated with Prevent Blindness Texas. It's an organization here in the state of Texas, and it offers free service. Vision screening, and then if they do require glasses or bifocals, they have a program that assists the individual to purchase these items, and it would be free of cost for the individual. So we've been putting that on social media every Monday for the new services and the collaboration that we're doing with the PBT. But we do also let them know here at the health department, if they were to get services, they get vision. This is a secondary resource that if they don't have insurance, the PBT comes into play to fill in that gap. Taking care of your eyes awareness. These are all awarenesses throughout the year that are going to focus on eyesight and preventing secondary issues. Texas, and to be able to refer individuals. And again, this is going to be for students and adults. Children, from what I was told, was that process works and insurances, but where they were seeing the gap was college students. Once they are off mom's and dad's insurance, college students go to school and they're like, I don't have health insurance. What do I do? Well, this was a secondary source for them so they could be able to have, of course, the screenings and the resources to obtain their glasses. And then it goes into an adult application. So there's all these resources here from the health department as well as the PBT for glaucoma awareness, any eye safety awareness month. I assist us with that resource for screening and having the individual be provided eyeglasses. There's another initiative. Fitness. I'm sorry, I'm just going to bring up something real quick. Chair Fitness is it's a comprehensive exercise program that's designed for individuals who have complications standing during a fitness regime. This includes children to senior citizens, people with balance issues, injuries, disabilities, or suffering from obesity. It's designed to keep individuals I myself got certified in this area as an instructor. I did it because it was I was working with my son. this type of workouts. It's fun. It's in a chair. It's something that she'll love to do. And it just popped in my head, and I said, you know what? I think right now with us being at home, a lot of, especially my able to go exercise, because one, studies here in Laredo show that children and young adults, even adults with disabilities, are in the obesity range. It's a high percentage because of their physical disability, or there's not enough programs, there's not enough fitness programs. So this we're going to be presenting this initiative, chair fitness program, and it be virtual, so parents at home and children at home can connect. Again, this is it's a project. We still have to get approvals for it, and of course go with legal to see if it's going to be able to be presented, because I know even with Zumba here we have a guidelines and process. So we thought this would be a great initiative, go beyond these barriers of not being able to get fitness programs. Other than that, that's all the news that I have. Does anyone have questions on any of the topics or?
No, Christina, thank you so much. You said
Yes.
Yeah, we can
okay.
see.
Yes.
Okay, good. You said quite a bit of information, and so do you have a I don't know if it would be handy or convenient or helpful if we were to get like just an outline of what you're going to be speaking, bringing up that the city of Laredo in your program is implementing, and quite a number of achievements and refunding that you've had. I'm really interested in the part about the COVID not being, and so I think it's really that are attending to them know a little bit about them and what they like to try to minimize the impact of pretty much being hospitalized and having no one from your family show up to visit you because it's not allowed. So, so thank you so much for the information you've given us.
Yes, definitely. I'll go ahead and email all the information with details. The one.
Be I don't want where you're going and where you've been, okay, so that we know, so that we can better use, have better use of the information. But regardless, the information that you provided us was really in there. Months, I don't know how many
I'm here, Mr. Castillo, and I'm running low on battery, so that's why I had to shut down my video. But Christine had a very thorough report on our efforts here with the City of Laredo Health Department. We're very fortunate, and it's a testament to their work that we continue with this grant fund to reach these special populations. We are very fortunate to have someone like Christine who thinks very creatively to outreach, to consider programs that are innovative and new for our community. So we're very excited for what's to come. And even though we still have to, you know, work within the bounds of safety and addressing the pandemic, they're doing huge strides with this program. So we're very excited. So no announcements on our part. Like I said, Christine had a very, very thorough report.
Absolutely, she did.
Mr. Chair, may I
Yes.
make a quick announcement, please?
Yes, Dr.
Just addressing the proverbial elephant in the room, which is COVID-19. I just want to salute the health departments. They've done such a great job, and I know they've been burning the midnight oil and putting in way more hours than they probably should, trying to take care of all of us, getting our vaccinations, calling people to make sure they come in for their second. So I just want to salute them and just thank them for taking care not just of our disabled and sick people, elderly, handicapped. I'm just grateful for. That's it.
Thank you for bringing that up. And I know we're going through some real difficult moments, and so I think to keep up, maintaining, and be and we're at a real critical point in Laredo because we're losing healthcare workers and nurses and doctors to people who are putting just a lot of with almost 90% of people that are staff are out of state nurses and stuff. And so state of Texas has done a real good job about hiring and contracting with organizations that have medical staff, but unfortunately that's also affected our own native staff here, and they've elected to also take work with the state. And so really appreciative. It requires a lot of work when you have outside work, employees coming in, especially for your HR department. So with them. And I know because my wife is the HR director in one of the hospitals, and she's like, it's nonstop. It's nonstop. They lose employees, and the state shows up with a bus load of nurses, which we're very thankful down the floor as soon as they walk off the bus. So, but but hopefully things will start turning around. This COVID situation has really gotten really bad. Who would have ever thought that we were going to have 400,000 people die on us? Okay, and so administration, hopefully the vaccine issues will be remedied and pushed and promoted much faster than they are now. Unfortunately, I think it's just the country's going through some phases that we have never experienced before, and so okay, because that's what's being projected right now. And
Mr. Chair, I think we're all trying to do the very best that we can, but like I said, I just want to say thank you to Erica and Mr. Chamberlain and just everybody at the health department, because I know how hard they're working. And it's, take care of yourself, Erica. I know you're overdoing. Knowing you're a perfectionist. Just take care of yourself. And for the whole committee, y'all stay safe. Be careful.
thank you, Doctor. then?
Mr. Castillo, and if there's any questions on the vaccine, you've touched on very important points. We the distribution and of course, production, a lot of things. But yes, Richard and I stay committed to ensure that our population, especially the most vulnerable, get the vaccine. Like need to get all these people fully protected. But feel free to reach out if you have any questions. We're trying to facilitate as many appointments. I know it was a hot topic of discussion yesterday at the council meeting. People and I see the feedback. I see social media. They think they can do it different. They can do it better. It is a huge undertaking, but and we are fully committed to ensure. And I don't know if you're spying on me, burning files.
I just know how you are, and I'm concerned that you're probably not getting enough sleep and don't stop for lunch.
And you can, I know you can see it, but
No,
but
it's
I'm
not
okay.
that. It's just I know you, and I know how hard you work. Just anyway, so just be careful and get some sleep and take care of you, because if you get sick, what's going to happen to the rest of us, Erica? Take care of you.
Well, thank you so much. I will, and like I said, feel free, and this goes for the.
Erica, I have a question regarding the vaccinations. I think Dr. Ruthinger texted me or called me sometime back asking what was required to access the vaccination, in the sense of are you needing a doctor's prescription? And if how do you prove that? Is that enough to take your meds and say, look, I'm on all these meds? Or do you need an actual physician telling you, yes, he is this, okay?
There are some people that have been able to secure a doctor's note documenting the state reporting. We're kind of doing an honor system. So, and of course, we have to be cognizant that we live in a community that has is that if your BMI is higher than 30, and that could be a lot of us, you're eligible for the vaccine. So might be that have those higher BMI. Yeah, just self-reporting. We really don't question. We hope that the individual understands why we are doing this priority groups, why we're phasing regarding reporting.
I didn't know how how challenging it would be to go make a doctor's appointment to get an excuse. So that's people are just not going to do that.
Right.
Okay.
So self-reporting is sufficient.
Thank you, Erica. Any other questions or issues or concerns?
Just if we can confirm, we are all okay to schedule the next meeting at the third Wednesday of next month, which would be the 17th at 11.
That'll work.
Perfect. Okay, that's the only housekeeping note.
Okay, no, the 17th will work. Janet, thank you always for for taking minutes. And then,
Yes, sir.
I'm still waiting for the white-tailed deer to run across the background there where Diana is at.
I wanted to share, I did take the Pfizer vaccine on December the 23rd. Really, it was just by the grace of God. One of my nieces is a nursing student, and they got a in line, and they had a few doses left. They actually realized they got more vaccines than they had requested, and so they can't refreeze them. So they had a small window. Minister first come first serve, so as not to have to throw them away. And so I woke up at 4 o'clock in the morning, jetted off to San Antonio, and got the vaccine, and then got the second one on January. Sick, my arm, it was a lot of arm pain. I had a severe migraine. I felt like when you're gonna get sick, like a cold is trying to get you. But it went away within a day. And so it was, before all of this discussion on them not having the backup vaccines and all that. But I know that there are still a lot of individuals, I know there are in our agency, that throw out there that, I know we can't force anybody to take it, obviously, but just highly encouraging people to take it, because the quicker we can establish the herd immunity, to throw that out there.
Agreed.
Guy, I also agree with you that there's some hesitation and there's been some concern because unlike other vaccines, this one took 9 months as opposed to others that take 9 and 10 years, 15 years to produce. Probably survive with a vaccine, but you're not going to survive the disease. And so although I was one of those that was very hesitant and I kept saying, I'm not going to take it, I'm not going to be anyone's guinea pig. Right now, I would look forward to and that's how come I was asking Erica what requirements there are. I'm not 65 yet, but what is it that they need from common individuals who may have an underlying condition? I mean, how do you prove that? So the fact that they're going on an honor system, that helps. So congratulations, you're like COVID free.
Well, actually, what they shared with us is that the vaccine we got on the 13th of January, the second one, that it actually takes 2 weeks from that vaccination to be covered. Kind of like a flu shot, takes a while to actually kick in completely. So I'm looking at the calendar to like the 27th, but even then, it's so you still can get COVID. You're just obviously have a less of a chance, which is what we all want. So I had a friend of mine that said the same thing. Well, it was done in 9 months, and I don't know, but it's all about money. Vaccines are all about money. It's not really about that they take 10 years. It's that they don't have the money to go to the next phase and go to the next phase. And so the government was able to release all those. Creation is very, very, very expensive. And so the fact that they had the money up front allowed them to create the vaccine as quick as they can, which is usually not the case. They get money in phases, kind of like we're getting the vaccines a little bit, a little bit, a little bit. So with people that really it's about money. It's not that they cut corners or rush the process. It's just that they have the money to do it quickly. And that's usually not the case. So
Jeanette, I have a question to ask you, if I may. What was the nature of your headache? Because I've had one of the dosages and I feel like a pressure headache. And I don't know how much of that is tension from, when will I get the second or first. Could you describe your headache?
it was like something I never have experienced. I've had headaches before. I've even had migraines before. Well,
How did it feel? Like
it
pressure?
felt like I got hit in the back of the head with a 2x4.
So
Part of my deep inside my head. Noticeable, very prominent. But it went away half a day, maybe a day. Kind of thought of how would my body react if I got it. You know, some people just have a little everything in between. And I just think to myself, not to be negative, but I think if the vaccine did this impact, I don't think I could survive COVID. Honestly, it just imagine they're just to fight it off. And I thought if I had full COVID, I just kind of feel like it would take me out. I mean, I don't know. I just that's just my own anxiety or what.
I've had a lot of anxiety in regards to getting the vaccine. Not that I don't want to, but rather that I want it, and I don't know if I'll get the second dose. Jeanette, I wanted to also tell you I've been reading about COVID and the vaccines and the development a lot lately. The CDC website says that Pfizer, the efficacy is 95%. And the Moderna is almost there. It's 94.5. So, standard error of measurement, we're right at around 95%. But it's recommended that even though we complete our therapeutic dosage of the two vaccines of whichever,
Absolutely. Absolutely, yes.
yourself and others.
Mm-hmm. Thank you. Yes, absolutely. I agree 100%.
Thank you for sharing.
Well, my understanding is that you can still get it. You can still the effects would not be as strong as otherwise. We're not vaccinated. When you have 20, 30, 40-year-olds and they're much stronger and they're very fit and they're in the hospital and they're on ventilators, that's unexplainable. That's just,
Yes.
how does that happen? I don't know.
It's baffling. Yes, it is.
I think that
Asymptomatic. I'm sorry. Yeah,
I think
the recent readings I've done is that most of the passing on of the virus expressing any symptoms. So they could be tested, their temperature taken, they go into a building, but
because if you look at the precautions at doctor's offices, at least my thyroid doctor in San Antonio, she had someone testing people to see if they had a fever before they came in the office. But again, there's a great population that is asymptomatic. Sure, this thing, we don't know enough about it. And it's so contagious.
Well, the new variant is probably double as even more contagious than the original version. And it's not it's not more dangerous, but it infects people much quicker with a shorter exposure time. And so over these, the more it mutates and the more likely there's going to be more variants, okay? And promote the vaccine as much as we can. Because I know that I've been approached to some people that are highly educated and they tell me, I'm not going to take it. I'm like, what do you mean you're not going to take it?
Told us at our last meeting that they surveyed the hospital, everyone, whether you served at the cafeteria or you were mopping the floors or you were a physician or nurse, didn't matter, they were all surveyed. And they were at were the ones that said, yes, I'll take it. But that means that 25% said, no, I don't want it.
Some people are just scared of needles, period. Okay, so you're not going to get them to go any further than that. But just take care of yourselves, wear your masks, stay away from as many people as you can.
I tell my husband every morning, stay away from people. People have cooties.
That's right. Just layman's terms.
Cooties.
That's right. Yeah.
But anyway.
I heard that Laredo was on CNN News. Is that correct? Because I haven't been able to find the clipping. I don't know. My friends are pulling my leg or. And news recently.
Oh my!
But I can't seem to find the.
I'll look for it. If I find it, I'll send it to you.
Okay, yeah.
The highest percentage of individuals with COVID. Okay, I know that you've got your large cities that get the attention, like Los Angeles and Phoenix and Chicago. Those are like the three because they're so big. But percentage-wise, Laredo is right up there. Okay, because I think nationally the infection rate is like 17%, and Laredo's at 30-something%. We just need to be very
because we're very touchy. Our culture is very touchy-feely, and we just cannot do.
Very family-oriented. Yeah.
Yeah, so you need to eat alone. Okay. So if there are no other comments having to do with the
Move for adjournment, sir.
Okay, can I have a second?
I second that.
Okay, thank you, Jeanette. And so hopefully we'll stay healthy and we'll see you all next month then.
God bless you, everyone. And Erica, get some sleep, please.
Thank you. Stay safe.
Everybody.